Welcome, Dr. Bhasin. Thank you for joining us in this event, which is Metabolic Health Conference, where we have had 47 guests from 15 countries, and it's India's first of a kind event with such a wide variety of speakers. And we're glad that you could join us, and so that our people who are watching us, or maybe will watch this recorded session, will get a lot of insight. So without further ado, I'll just give a brief introduction about myself. So I'm Harshal Subarnakar. I am a metabolic health coach, and I'm founded something called as Nutrition Lab, where we do nutrition-based research and help people reverse diseases through nutrition and holistic approaches, which are not in the conventional field. So, then we have with us right now is Dr. Swaranjit Bhasin. Dr. Bhasin is a prominent radiologist in California, United States, with over 15 years of experience. He was born in New Delhi and grew up in the Bay Area. His medical interests include cross-sectional imaging, especially CT and MRI in abdominal and musculoskeletal imaging. He's currently associated with Kaiser Permanente, which allows the flexibility for patient care, where physicians can provide the best possible treatment for the patients in the way the physicians want to. And the organization is also well known and respected in the community locally over there. And as I'm told that this community or the Kaiser Permanente group has about 10,000 doctors associated with them. So it's a very large base that Dr. Bhasin works with. Dr. Bhasin, especially being a radiologist, he also advocates in treating patients who are metabolically affected or otherwise. And he has developed this first principles thinking, which I think we'll hear from him. Before we start, I'll hand over to Dr. Bhasin for some few words, then we can start the session with him.
Thank you, Harshal. Great to be on this format, first of its kind in India. I really want to congratulate first, the Indian community for putting this together. I think it's very necessary in India and throughout the world. So I'm really honored to be part of this event. I just want to give a little background of myself, and so the audience knows a little bit. I'm not as famous as some of the speakers that have been on this. And I've actually learned and watched some of the speakers that you've had in day one and day two. So these group of individuals are amazing, and I think I was not aware of them before 2022. So this is where I've been practicing for about 15 years now. And something that always bothered me in the back of my head was, why are we seeing cancers in younger and younger patients? I myself, as a diagnostic radiologist, I see mammography. So we're diagnosing breast cancer. And I've, as the years have gone on, I've seen cases of cancers in younger and younger patient in their 20s and 30s. So this is actually before we would even do screening mammography for them. And again, rectal cancer is another one where we see very young patients in 20s and 30s getting rectal cancer. Again, the screening will not catch these patients because they're not at the screening age. So that was my really, one of the things that really bothered me on the back of my head throughout. And why is this increasing? And this is where last year, 2022, I did a deep dive into just diet and nutrition and what can we do to really help patients. And this is where I found some of the speakers that have been on here that have been saying for a long time that low carb, this is the problem. We need to really vilify carbs, which is really getting to the root problem of insulin resistance. And this, I think I learned everything last year, 2022, what I should have learned in medical school. And for some reason, this is part of the problem is where we're not learning diet and nutrition in medical school to connect the dots, what the root cause is. And this is where, ever since last year, I've come up with, just something very, very simple message that I can really convey to my colleague, my staff member, any patients within 1 to 2 minutes. So I've considered myself that I'm going into more healthcare marketing from a radiologist standpoint, just to get that message across. And that's my forte this year. I've been just developing that. and just getting the message across on how we can really reverse disease and prevent cancers. And non-alcoholic fatty liver disease is another one of those things where I'm just seeing more and more CT and ultrasounds. I see cases routinely. I'm a body imager myself, and almost half of the cases that I'm reading on CT and ultrasound, I'm seeing fatty liver disease. And sad to say, even kids as young as 10 years old have diagnosed with fatty liver disease. And this is where there is no pharma medication to treat non-alcoholic fatty liver disease. So we really need to give solutions to our patients on how we can tackle this. So this is my journey, but I'm really new to this movement of low carb, but I'm really passionate about it, and really honored to be invited to this speaker session.
Thank you, Dr. Bhasin. It's interesting to know about how interdisciplinary complements, like medicine and, like you said, nutrition. If we combine that, I think it has got a lot of healing power, and I think we can look forward to maybe a very lesser proportion of disease in the world if we combine these interdisciplinary advantages. So let me start, by asking you, given that you do radiology, and you spoke about non-alcoholic fatty liver disease, which is basically having a fatty liver without consuming alcohol. So the non-alcoholic fatty liver disease in the world, along with other metabolic diseases that we see, are growing at an exponential rate. And if I had to quote a statistic, just for everybody's knowledge, in 2016, a study said that global prevalence of non-alcoholic fatty liver disease is in 25.2% of the world's population. So just imagine this. And when we see cases, and maybe if around, if I'm sure that in anybody's sonography that you see, you'll at least see a grade 1 fatty liver in India. With given this background, what's your perspective on non-alcoholic fatty liver disease, sir? And what's its progression? What are the causes which is causing such a global prevalence, and why is it rising at an exponential rate? If you can just throw some light on that.
Yeah, I think the root cause, again, we have to go to what is causing all this exponential increase. And if you look at it, the rise of sugars in our diet, high fructose corn syrup, which is metabolized in the liver similar to alcohol. We really need to understand that this is the problem, where we're eating. I'm going to quote just the American diet. 60 to 70% of the American diet is ultra processed foods. And these things are filled with sugars, high fructose corn syrup, and vegetable and seed oils. That's one of the other problems in our diet. And this is really the cause of the rise. And I've seen numbers as high as 45% of the US adult population having non-alcoholic fatty liver disease. And we had, I had one of the guest speakers that came and speak to our physicians in Kaiser, Dr. Robert Lustig, very well known in the community. And he said, this is the silent epidemic. This is the epidemic that we really should be talking about. COVID was here and it's gone now, but this is the new epidemic that is really, really prevalent, and it's a silent problem that we don't see till later on. It brews inside, but as a radiologist, I see this now, and what I've started doing is, when I see this on my imaging, I might be the only radiologist in probably US and probably worldwide that I'm actually writing a prescription on the report on how patients can reverse this, because we really need to empower our patients. They can take charge. There's no medication that, the primary care doctor is going to write. There's no GI doctor that's going to write a prescription how to reverse this. So as a radiologist, I'm putting it into the report that this is what you're going to do. These 3 simple steps. You're going to go ahead and reverse this and empower the patients. And I think this is the magic pill. We're talking about we're always searching about what's a really good drug that can really have a lot of effects on different things. And I think the diet and the low carb that this session is about, that is the magic pill. And I've noticed that this cuts across all the things. It's not just GI that can get help with the low carb. It's the oncologist, because cancer, we all know, is also linked to insulin resistance. I can reach out to the neurologist. If you want dementia prevention, that's how you do it. You do it with your diet changes, to try to reverse, again, the root cause. I've started calling out insulin resistance. I'm bringing it up in almost all the conversations, just to bring it up to the forefront, because this is the elephant in the room. We're actually not doing a good job calling it out. So I think we really need to bring it to the forefront, that this insulin resistance we need to tackle. And how can we do it simply? And that's my marketing message that I've started advocating.
Thanks for that. It's very insightful to hear directly from the horse's mouth, given that you see the scans firsthand, and interestingly, you as a radiologist, you'd be, I think, one of the only maybe in the world who would be giving a prescription. But to know from you, given that liver is the only organ which can regenerate itself, and it's like a fully functional factory which has like various processes. From your clinical experience, if you can just tell us as to what kind of lifestyle can damage it. Like, isn't it that, the extremes will only damage such an organ which has the ability to regenerate itself? And basis your years of experience in terms of the cases that you've seen, like you said that, kids also have it these days. So if you can touch upon that topic a little bit more in detail for the curious parents who are listening to us right now, and what is the things that you prescribe to your patients for especially non-alcoholic fatty liver disease?
Yeah, I think this is where it gets into my 3 simple step message. First step is to avoid seed vegetable oils. And these are really, really, and this is something that my son actually helped create after I did, a talk with the 3 simple steps. So I'm going to just show, if you can go to that first page. And then, I see patients that come in for mammography. They're getting called back. So we read the mammograms, and if we see anything abnormal on there, what we do is we do a callback where a patient comes back and we do some additional imaging. And majority of the time, it's usually nothing. So what I do is I actually pull out this little trifold and I show patients this. So what I do is, the bottom right of the screen, it shows the multiple different things. So I tell them what we're trying to do is we're trying to prevent cancer and dementia. And we're also trying to reverse all the other 6 things that are on there. And again, pointing out to the top left, I tell them, what is the root cause? The root cause is insulin resistance. So if you go to the second page real quick, and then I'm usually able to get through this, within about a minute or so. I'm able to tell them. So this is the quick little message. I'm hoping I can even get you all to really follow this. First is to avoid the seed and vegetable oils. These are made in the factory, really unhealthy. And I'm sure in India, there's, again, a lot of marketing, how to sell these things. There's a lot of commercials saying vegetable oils are healthy, but no, if you look at it, how they're made and processed, it really is terrible. And this is where we really need to, and this is one example I like to give to my patients is large fries at any fast food chain, the toxins are equal to 28 cigarettes. So this is what the toxicologists are telling us. Toxicologists have separate meetings, MDs have separate meetings. We're not listening to each other. So we really, really need to listen to what the message is from the toxicologists. And then we need to give healthier alternatives to our patients. And this is where the message is very unclear. Saturated fats is unhealthy, but this is where the data really shows all these simple fats are really okay to use. Butter, ghee. In India, you should be using ghee and coconut oil. Those are really big and healthy Don't shy away from these two superfoods, I would say, and olive oil, and avocado oil, and I think beef tallow probably not utilized in India. But give the message what to avoid, what to use. Very simple. Second step, eat a diet low in processed carbs and sugar that uses healthy sources of fat. I mean, and this is where I've learned from all the speakers in this series. It really hits home. Low carb is important. If you look at it, I want my patients to have this image of blood insulin response to the different macronutrients. Carbohydrate, huge peak. Same thing with sugar and high fructose corn syrup. Protein is in the middle, and fat is a flat line. So this is where I think in healthcare, we really should be unvilifying healthy fats. Fats are okay. You know, we really have to get out of that low fat big food marketing message. So, and then, you know, shopping the perimeter of the grocery store, you can really avoid the ultra processed foods. The stuff in the middle, I say 90 to 95% are addictive substances, not even real food. So this is where I think in healthcare, we're fighting a addiction model, and we have to call it out. We have to say, you know, you having a sweet tooth, that's a problem. And then the last part, practice intermittent fasting. I think this is where Dr. Jason Fung, I would have to, you know, give him a lot of credit. I've learned a lot from him. I actually invited him out to come speak to our doctors, and he gave a message of demystifying intermittent fasting. And this is where this is a wonder drug that we really should be utilizing more. It doesn't cost us anything. Actually, it would save money for patients. And this is where the 6 small meals a day is very unhealthy and promotes insulin resistance. And most adults should be eating 2 good meals in an 8-hour window. And fasting really, really is powerful. And this is where, you know, everyone knows about autophagy probably on this call, but, you know, any listeners out there, 24 hours is approximately the time where autophagy kicks in, where your body goes around and cleans up your own damaged cells. And if you can go 36 hours fasting, that actually kicks in, it increases 300%. So this is where we really need to utilize this drug, and we should all be writing more prescriptions for this. And this is my little message. And again, this helps with non-alcoholic fatty liver disease. So this is where I would tell parents, if you're going to treat your kids to something, you know, they've done a good task, you're going to take them out for fries and soda, that is actually very damaging for their health. So I would try to tell them, you know, pick some alternative places, pick a local restaurant that cooks in better oils. You know where the food is coming from. So I think this is where we need to shop more local. And I think fast food is something that was exported out of the US, and it's just unhealthy anywhere. And we really have to call that out.
Yeah. I think that's put really powerfully. You know, I think we should credit your son for making this, and you know, it's a real powerful message. You know, just 3 simple steps: avoid processed seed vegetable oils, low carb, and intermittent fasting. That's really powerful. You know, in fact, you know, Ben Bickman and Jason Fung were there in another conference, and they put it very nicely. And you know, we've just got another research which says that, you know, we are biologically fit for, you know, going into ketosis. Basically, when you do low carb, you know, your body takes in the fat, so you need to be in a fasting state for a longer period of time, and little time should be your feasting state, where, you know, you don't see any other the you know, form which goes always in a feeding state. So, you know, when you go in a fasting state, that promotes a lot of advantages, and that's how we are biologically built. And I think these 3 are very powerful messages, and for the audience who are listening to us. So, you know,
and I would tell you from personal experience, I was under the marketing thing that we should be eating 6 small meals. So before I learned all this stuff, I was actually doing the same thing. I was eating small meals, snacking throughout the day. But I think that has, again, you have to stop and think, who does it benefit when we're eating 6 small meals a day? The only one that it benefits is the big food companies, because they're selling more of their processed foods. And if you are not satiated with what you're eating in the ultra processed foods, you're going to need to snack in between. So once I realized that message, you can understand how to really break out of that. And now I just usually do a couple meals a day in an 8-hour window, and it is hard in the beginning, but you can easily get used to it.
Okay. And just another corollary, I just remember, another bioscientist, he just quoted recently saying that, a calorie in, calorie out concept, is a physics concept. But, when you apply pathophysiology, where you combine physics and biology, you need to understand the balance of hormones, which is when insulin kicks in. And hence, you need to understand how fasting, time restricted eating, low carb, and, having more carbs, what kind of an expenditure, say. So calorie in, calorie out model might not work when you put it inside a body, like it's biology also. So, one needs to understand biology before we put that model inside for us. So that's great.
Exactly.
Yeah. So that's great insight, sir. So now, like you touched upon, non-alcoholic fatty liver disease, but then what we've seen is, that, this thing has changed. This is just an example that I wanted to show to you, that since the 1970s, the kind of liver mortality, so mortality because of liver diseases has like just shot up. So maybe would you want to pay some of your insight as to why would this have happened since 1970s? We understand that, uh, processed foods, etc., has increased, but, it's just at this point that we see as an increase.
Yeah, and if you look at this, if you had another chart with showing seed and vegetable oils, you would actually see a similar kind of trajectory going up to the right, and especially starting after the 1970s. And this is where I think you really have to understand the money. I think the fiat money and the incentives are really perverse, I think, in healthcare and nutrition. So during my learning in 2022 about nutrition, that's another thing that I was studying is our monetary system. And something happened in 1970 is, I think it was 1970 or 71, Nixon took us off the gold standard. So there is nothing backing the US dollar, and the fiat money can be printed, out of thin air. And this is where I usually recommend folks to, there's a great series on YouTube, Hidden Secrets of Money. Just watch that to learn what we use day to day. And that gives you insight into nutrition and what the big food incentives are in all of what we see in the store shelves, and why they're, the incentives are profits. And I think one of your speakers yesterday was saying that, yeah, the corporations and the government, they're not going to help us change this. We have to do the work on the ground. And the reason why we have to do the work on the ground is the public-private partnership. They're aligned with the profits. So that's not going to really help. But the conferences like this, doctors that are getting out there and getting the low-carb message out, this is the real way we can really make change. And I'm hoping to be a part of this. Make it very simple. That 3 simple step message, I tell all my patients, next time you go through the aisles of the supermarket, I want you to think about me. And be careful, put your guard up. I want you to think twice before you go in there. And I think they do really appreciate that. But yeah, this is where we really have to get to the root cause. The root cause of the health going bad is insulin resistance. And I think the root cause of the whole system, why we don't see change and why obesity and diabetes keeps going up, I would have to call out the fiat currency. So this is where I think Herschel has a little bit finance background, and I think Herschel would probably understand this more. But again, Hidden Secrets of Money, first 4 episodes, must watch for everyone.
Yeah. Thank you. So, that's the benefit of, this we speak of, interdisciplinary advantage of understanding and linking both fields together, like how the hidden kind of incentives for the companies to do, which is basically making money, causes all of this. That's an interesting insight, and how we can connect interdisciplinary knowledge. When we talk about non-alcoholic fatty liver disease, can you maybe explain from a doctor's perspective as to how the progression happens? What at what stage is it irreversible, and what is the linkage between fatty liver disease and the other metabolic syndrome, of how it affects people? Maybe just a short summary for people to understand.
Yeah, and this is where one of my colleagues, Dr. Singh, he's a GI doctor. He actually gave one of the talks in our group, and he described that by the end of this decade, there's going to be more cirrhotics due to non-alcoholic fatty liver disease than from hepatitis. So all the different viral hepatitis, this is going to take over. So this is where if we catch it early enough, we can easily reverse it with our diet changes. But if you leave it, some of them progress on to NASH. And then eventually, if you're not taking care of it, some of these fatty liver disease will progress on to cirrhosis. And this is where, if we don't change the tide right now, we're looking at more cirrhosis from non-alcoholic fatty liver disease than all the other hepatitis. So this is the epidemic. Dr. Robert Lustig, we need to listen. A great doc. He has, I think, Sugar, the Bitter Truth. I watched that, and it's like, wow, that medical lecture. It really shows what's going on. I think he gets into all the details of sugar and how it's metabolized. Yeah. I can't really, as a radiologist, I'm not that good at getting into all the different steps. But this is where we really need to get all hands on deck. And if we're tackling non-alcoholic fatty liver disease, guess what? You're reversing all the other stuff too. You're getting the benefit. The side effect of treating non-alcoholic fatty liver disease is you're going to reverse type 2 diabetics, pre-diabetics. You're going to help with blood pressure, and you're going to prevent cancer and dementia. I think those are the biggest things that we worry about, right? Cancer. Yeah. We don't want cancer. And I think the metabolic background of cancer, that's catching up more and more. And I've seen a lot more prevalence to that. I'm glad that there's something that I can do. I can help my patients and members to do to prevent cancer in between now and their next screening. Not just say, oh, keep getting your screening. We're actually trying to stamp out cancer with this. Sorry, I got a little off track, but non-alcoholic fatty liver disease, I would say, yeah, the mechanisms and stuff, I don't know as much of the detail, but this is where we really need to reverse the tide.
So, sir, like we've been touching upon cancer, but then, when we've been reading and doing a little bit of research, newer studies now say that, you have decreased level of estrogen as a result of insulin resistance, which increases the risk of developing cancer in any organ which has high levels of estrogen receptors, which is including breast, endometrium, and ovaries, which is especially on the female side. So how have you been, like you've said, it is increased. So what has been your experience in terms of seeing these scans and, a lot of these patients getting this? And maybe if you can touch upon, how it has helped, in line with, as a treatment with conventional therapy, which is chemotherapy, how low carb will be able to work, given that, we understand that these cancer cells have a high amount of insulin receptors, given that it is bereft of the liver, basically. And if it doesn't have access to the liver, it cannot produce or energy from fat or protein sources, so it only can take glucose. So it has a high amount of insulin receptors, is what we understand. So if you can just touch upon this for our viewers.
Yeah, and I think this is where, if you look at CDC, the website, they have that there's 13 different cancers that are linked to increase 13 cancers that are linked to being overweight or obese. So I'm just going to give some of the numbers. In the US, 73% of adults in the US are overweight or obese. And then 35% of kids in the US are overweight or obese. And I think probably India is not too far behind. I think it's probably not as bad in India, but this is where we know that this is all linked to insulin resistance, and we really need to reverse that. So if you're a little bit overweight, the best way, again, you really need to reverse that insulin resistance. And I think we haven't offered the right kind of messaging on how patients should lose weight. We always keep saying, eat less and move more. We've always given that mantra, but that does not work because we're not getting to the root cause. Because obesity is a hormonal, not a caloric imbalance. Dr. Jason Fung, I've learned from the guru, this is where we really need to tackle the insulin resistance. And again, you're talking about the hormones. The hormones is what we need to get to. And this is why I've seen in my career that I'm seeing younger and younger patients coming in with diagnosed breast cancer. Young patient feeling a lump, we would think it would be something benign, but all of a sudden we're seeing a big mass, and then we have to do a mammogram to see, and there's cancer. I see cancers in bilateral breast, which is quite unusual, where someone comes in and it gets diagnosed with cancers in bilateral breast, but that is happening more often. And again, it's all linked to this. Simple messages: get to the root cause of insulin resistance, and you can do it very simply. And we got a lot of experts here to learn about low carbs. Really listen to them, because I think they're giving the right message. We're messaging that we really need to vilify the carbs and sugars, and then unvilify the healthy fats. We really need to get that messaging out. And again, the seed and vegetable oils, get rid of those things. The Indian diet should be using the good quality desi ghee and coconut oil. I'll advocate for that. If there's any brands out there that need a spokesperson for desi ghee or coconut oil in India, please reach out to me.
That's interesting, sir. So have you had or maybe some cases of maybe reversal in these non-alcoholic fatty liver disease, and after the reversal, what has been the patient? What do patients think with you when you see this, and how happy are they when they come back when things look okay?
So I've started doing the prescription in my reports for about 6 months now, is what I've been writing. And I've reached out to my colleagues so far, primary care doctors, the GI doctors, and the ED doctors. They're all really, really happy about it, because they usually, they don't have time to spend with the patient to sit down and do the diet and nutrition and stuff. And we can't send so many people out to educators. So just having that message there, I know the clinicians have been happy. I'm very sure I'm going to get results fairly soon. I haven't started hearing about any of the positive things yet, but hopefully soon I'll have some good results. But this is shown, it's proven to work. And I think a lot of practitioners out there, I think you guys have a lot of data where you're reversing non-alcoholic fatty liver disease, and it's very doable. And I know it works within 2 to 3 months. This can really be effective. I haven't seen personally. I haven't seen the thing, but I know it's working. But I will reach out to all my colleagues. And again, this is where radiologists are usually consultants for other physicians. So the main interaction with the patients is very not as often. If someone's coming in for like a fluoroscopy study, then we have patient interaction, and then mammography is the other big one. And that one I usually utilize each moment I have with a patient. I really try to connect and make sure I'm talking about the diet with them, and they're really, again, very appreciative of someone taking out the time and letting them know the clear message, what they can. And again, they look at the pictures on my little trifold butter. They're like, "Are you sure, doctor?" But yeah, this is where I have studies showing, and Journal of American College of Cardiology says, saturated fats should not be feared. That was from, I think, a 2020 state of the art review.
And it's quite the contrary, right, to what they've been saying. So, saturated fats has been termed as a bad, and I guess what you've said on saturated fats, it goes with the practice that, at least in the low carb world, goes that, saturated fat is in fact very healthy, and you see
And then
great. Yeah.
and then I've seen, I was just getting back to your point about cancers also, and this is where I've seen a lot of momentum building and a lot of research going on, that ketogenic diet, how it can prevent cancer and augment traditional therapies. Someone that has been diagnosed with cancer, if they're on a ketogenic diet, it can really help them get through that, and help with the treatment process as well. So this is where another one that I really need to help vilify in healthcare is the ketogenic diet. I think sometimes physicians just hear ketogenic diet, keto diet, and they're afraid of it because it sounds too extreme. But the data, I mean, overwhelmingly, every day I see something on social media or Twitter, one of these experts putting out a study that ketogenic diet has been shown to do this. So all the data is coming out, but we need to stay ahead of that and make sure we're getting the right messaging across to the patients that are following something like a ketogenic diet.
Yeah. Yeah, and it's interesting that, new research also speaks of, how ketogenic diets or maybe low carb especially helps in cancer treatments, in along with uh, conventional chemotherapy treatment, and it actually helps augment the results. And I think more research is going on, and hopefully, we get to the conclusion that, both in conjunction will help, in terms of helping putting cancer in remission, or reverse it. I think, whatever you said, I hope it opens everyone's eyes towards the dangers of ultra processed food, seed oils, and we maybe gain back the fight against metabolic health, given how it has raced against time, and, it's increasing like an epidemic. But, on a closing note, can you share some pointers from your radiology practice to, on our audience, on, although you've shared on metabolic health, and, uh, which diet, maybe exercise, and overall other things that you see, and how can one prevent getting there, or, reverse their metabolic health?
Yeah, again, this is where we really need to do healthcare marketing to really counter the message of the big food marketing, right? They have a huge budget. Um, they have lab scientists that make the food really palatable, and then they have the marketing that come up with the packages. So that's why when you go in the aisles, you're seeing like very shiny packages of food. So we really need to do a better job healthcare marketing. How, and this is where, again, the three simple steps I'm just going to lay it out. Avoid the toxic seed and vegetable oils, low carbs and high healthy fats, and then intermittent fasting. And then I would also say, if I had to add like a fourth step on there, that would be resistance training. I think resistance training is a must. Indian population, I think, they're hitting the gym a little bit more. I think I heard one of the other speakers saying that Bollywood actors are more muscular, so hopefully that is getting across. But this is where 3 days a week I should be going to the gym, and this is where I've seen data shows that you just need to do each muscle group. You can just do one set. You don't need to stay there and do multiple sets. One set is just as effective as multiple sets. So you can go to the gym, get each one of the muscle groups moving, and you should be able to finish within 20 minutes. So all of us can do that. The muscle is, I think it's the more I see about this, that we really are lacking that. So resistance training is a must. And then maybe if wanted to get to a fifth one would be little cardio. HIIT is really, really powerful. So high intensity interval training. If you're going to do some cardio, get at least 10,000 steps a day. And then when you're going to do some interval training, I would say once or twice a week, you should do that.
Yeah, that's really interesting. And before we end, on the muscle piece, it's basically GLUT4. Basically, it's like a glucose transporter 4 in the muscles, and muscles being so greedy, when you work them out, they just soak in glucose without the insulin, because that's the biological benefit available to them, that they can translocate the transporter, and without insulin, the only thing which can take in glucose inside is muscles. And that's an interesting point. I think the 5 points are very true of what you said. And maybe Sashishar, you'd want to take over.
No, see, first of all, I'm so happy that Dr. Swaranjit could come here and share his knowledge, because we are very keen to see what is a radiologist perspective. And the reason is, like in India, the fatty liver seems to be very rampant, and I'm sure it is across the board. It is everywhere. But what we are also seeing nowadays is small children's having central obesity. Overall, we kids were always lean in India. Now we see overall obesity. And what is the incidence of fatty liver? What is our exposure in kids, in small children? Do you get opportunity to see some fatty liver in them? How is it?
Yeah, this is where, as my practice over the years, it's been getting worse. I actually never used to see fatty liver in kids before, but for the last 3 to 4 years, I'm seeing more and more fatty liver disease in kids. And yeah, I was telling Herschel earlier that I saw a kid as young as it was about 10 years old 2 months ago with fatty liver disease. And again, I'm speaking to the pediatricians, and they're seeing it. They're seeing their patients get diagnosed with this. And this is where if I was writing a prescription for a kid, I would put just the first 2 steps on there. I would not put the intermittent fasting. That is not healthy for kids to do. But this is where, again, I think this is, we have to create an environment for the kids where we don't have snacks available all the time. Kids can be healthy. Give them 3 good rounded meals in a day, but eliminate the snacks and don't take them out to the fast food for the fries and soda. I think that really is one of the root causes.
I think you will be interested to know that there was a study which was conducted in Mumbai. So we have Nair Hospital here, which is government hospital. They conducted a study in 2016, and this study was done on school children of South Mumbai, southern part of Mumbai, South Mumbai, which is an affluent class. Now they found half the kids are having fatty liver. Some of them had even fibrosis. Can you imagine school-going children? And this is 2016. And this is officially published in some journal. I can send you over the link to the journal. Very interesting. You will be interested to know this as a radiologist. And this was 2016. This is 2023. We can imagine what is the extent of disease that would have spread due to this, the same thing which you say, the sugar and the vegetable oils. And that is what consists of all this junk food. And in South Mumbai, affluent class, frequently eating junk food is the norm. How would you react to such a study?
Yeah, this is really sad to see. This is where we think we're treating our kids to something positive. They're doing a good job in school. They scored well on an examination, and I think the parents are thinking they're doing a good job and taking them for a treat, but we don't really understand how bad these things are. And I would have to call out the fries at fast food again. I want everyone to have the picture. Large fries equals 28 cigarettes. So let's not inadvertently give our kids cigarettes. And then again, soda is processed in the liver just like alcohol. So if you're giving your kids like a 24-ounce soda, it's almost like that they're getting like 2 beers. So you're giving your kids 2 beers and a pack of cigarettes. That's not a treat. Let's not treat them that way. Let's give them some home-cooked meal with some desi ghee and coconut oil. And that's the way. Really, that's why, cooking at home really makes a big difference.
So it is not just fries, but ketchup, and then the huge can of Coke. And then we see this everywhere. See, in hotels also, if you go in the buffet corner, there is a kid corner. And in that kid corner, what do you find? All the sugary junks are there in the kids corner.
Right. And I think this is where the big food, again, this is where the money really gets into the advertisement, right? The advertisements showing all these sugary things, sugary products, and there's no warning label on them. So anything, this is what I tell my patients, anything advertised on TV, please do not grab, because that is the highest profit foods out there. And usually the most addictive is what is being advertised on TV. So we really need to, as health educators, we need to understand the root cause of why we're getting there if we really want to make a big difference. And I think the money is really important to also look at in this.
And did Harshil also touch upon, do you see instances of fatty pancreas?
He hasn't touched it, but I do see that on imaging as well. Yeah, for the diabetics, yeah, we see fatty atrophy of the pancreas. And this is where in the US, we have almost 100 million pre-diabetics. And again, 8 in 10 of these pre-diabetics don't know they're pre-diabetic. And I heard some of the statistics for India too, that you're close to the similar pre-diabetics. We need to catch these patients. Why aren't we doing more of these fasting insulin levels? Why are we waiting for the sugars to rise after 5 to 10 years to catch these folks? Let's catch them early. And this is where, again, just to keep it simple for my messaging also, I recommend when I'm talking to colleagues, 3 simple steps to check on metabolic health. How do we check under the hood? The 3 simple steps, which I learned from, again, a lot of the experts in the field, because I'm a radiologist. I'm not really ordering any lab work, rarely, but I really dove deep. And then the 3 ones are triglyceride to HDL ratio. Very important. That's the one we really need to look at. That's excellent marker of metabolic health. Second one is the fasting insulin. It's not being ordered as much. We need to order a lot more of these, catch all those pre-diabetics early and start reversing. And then the third one is hemoglobin A1C, which everyone's aware of. But I think once that starts rising, that's a little too late. Let's catch these people early and reverse. Let's not focus on LDL, which we tend to. And I think, again, money's involved. There's a lot of money to be made. So we really need to wake up to that fact.
I think you always have a very, very simple point of view. You have 1, 2, 3. You only have the same thing. And it's very nice and simple. Vegetable oil, sugar, intermittent fasting. So your 3 bullet point is really excellent and simple for us to know. And regarding the fatty pancreas, I think Professor Roy Taylor also in his study, he has mentioned in this diabetes reversal or remission, the presence of fatty pancreas. And then for his protocol, whatever he has recommended, he has seen a reverse in this, and then better sugar control. And I think that remains one of the crux, probably which needs to be explored in future, whether through imaging we can also identify fatty pancreas, a possibility which can affect the insulin level itself. Yeah, Arshil.
And I think I see it so often, the fatty pancreas. Maybe I've started not paying attention, but maybe I will, given your advice, I'll pay attention and see if patients are losing weight and if it's the atrophy is reversing and stuff too. Yeah, that's a great thought. I'll keep an eye on it.
Yeah, and I think what you said is very important, right? TG by HDL, which is triglyceride to HDL ratio, and fasting insulin. It's a preventive checkup. Like you know that you're getting there, that your car is going to go there, and it acts as a sign for somebody that you're going to get metabolically affected. So why don't you stop right now, go away from the danger, reverse yourself? And I think that's very important, along with subtle signs like your skin tags, acanthosis nigricans, which is blackening around your neck. Those signs I think are very important. If they get prescribed very early, or people know that these tests can be done, and they know that they are going to go on the bad path, or land up very badly, things are much easier. And of course, once your HbA1c is risen, you're already a diabetic. At that point in time, it's so difficult to reverse things, whereas when it's as a preventive thing, if you start just small steps right now, then you reach here at a much better situation than a curative test like HbA1c.
And then I would give the audience, like, triglyceride to HDL ratio. If someone in the audience listening is calculating it, you want to aim for less than 2.5, and then less than 1.5 is optimal. And again, how do you fix that ratio? If your ratio is bad, you cut down the carbs, right? Low carb. This is what you do, low carb, and then you're going to increase your healthy fats, including saturated fats, because you want the HDL to come up. So this is where, don't fear the healthy saturated fats, fear the carbs is the healthcare message.
I probably fear the
carbs. Can also tell our
and
audience on what's the level of fasting insulin that they should look at?
Fasting insulin, the numbers 2 to 6 is normal or less. Anything above that, you're starting to get a little bit insulin resistant. So time to start reversing that. Really, and this is where you don't want to be normal, you want to be optimal metabolic health. So this is where triglyceride to HDL ratio less than 1.5.
Yeah, that's very important, coming from a doctor like you, that given that the lab range is 2 to 24, above 6 is not optimal, is what people should know and pay attention to.
And ultimately, the very description of metabolic syndrome is the waistline, TG, HDL, blood pressure, blood sugar. Ultimately, everything boils down to insulin resistance. So this is what, if these 5 parameters are amiss, that means your insulin resistance. If your blood sugars are normal, that means we still have time to reverse it. I think that is a core fundamental